Sveiki visi, tikiuosi skaniai papietavot ir
Hello
turėjot
everyone,
keletą
I hope all of you have had a nice lunch.
O dabar mes
And
vėl grįžtame su lietuvių
now
pranešimu.
we are coming back with a Lithuanian presentation, and I am delighted to introduce to you Jokūbas Gužas, who is a doctoral student of our sociological research center. He is a researcher and psychologist, and he has done a huge study on the experience of young people and about how heterosexual orientation, non-heterosexual orientation is related to people's suicidal tendencies and well-being. This is the largest study of its kind in Lithuania today, and therefore particularly relevant to us in understanding our context and the everyday lives of the people we live and interact with. Jokūbas, please. Hello. I am delighted to be reading my presentation on this 10th anniversary conference. I am delighted being able to introduce to you the results of my thesis study. I would like to thank Paulius Skrubis, who accompanied me in all this process, and the whole team of the Suicidology Center. I felt your support. It was very important for me. I would like to introduce to you the results of the study. The name of my presentation is called Silent Shadows, Suicidality Among Non-Heterosexual Young People and Opportunities for Prevention and Intervention. I will refer to two publications where I'm the first author. These publications have been publicized at high-level prestigious suicidology foreign magazines. After the conference, I will share my slides, and you will be able to find links to those articles and to learn the research, to learn about the research itself in greater detail. And now I would like to present to you the main results of this study. So, introduction. How did I get the idea to launch this study? We should start with the main concepts. I will emphasize two out of the many: sexual orientation and sexual identity and gender identity. These are two concepts that reflect the identity, our identity, part of our identity. All of us have the sexual orientation, and all of us have a certain gender identity, and it's not the concept related only to LGBTQ people. But on the other hand, these concepts mean different things. Sexual orientation is the romantic and the sexual attraction towards a different person, which is, for instance, heterosexual people feel attraction towards the opposite sex. And in this thesis, I will be using another concept: non-heterosexual people, who are this is a very wide concept which encompasses all other people who are not heterosexual. These are gays and lesbians, bisexual people, and the less frequent orientations like queer people, transsexuals, transgender people, while gender identity actually denominates the feeling of sexual identity and contributing oneself to a certain category. For instance, we have cisgender, transgender, non-binary individuals, and in this case we mentioned the sexual orientation aspect. That is, we were analyzing the experience of non-heterosexual individuals, and here I would like to advertise the LGBTQI plus concept glossary, which was actually compiled by the association and by the Vilnius University, and this is a very useful tool for those who are working with this area. Everybody will be able to find the link to this glossary. Various studies show that non-heterosexual people much more frequently encounter various psychological problems, and one of the more visible problems is increased suicidality, especially at the earlier age, and that's why we focused on suicidal ideation of various expressions of suicidal behavior. Normally, we focus only on we will focus only on suicidal ideation in my study. The studies have shown that non-heterosexual people much more frequently have suicidal ideation than the heterosexuals, from 2 to 6 times, and the highest frequency of suicidal ideation is among bisexual individuals, so which means that some groups are more prone to this suicidal risk and some less. And all this gives rise to a few questions, and I will try to respond to one of these. First of all, what is the frequency of suicidal ideation among young non-heterosexual people in Lithuania? That is it relevant for the Lithuanian context? We don't know, because in Lithuania so far there have been no research in Lithuania that would analyze sociological aspects in Lithuania, and the previous research relates to other aspects. For instance, we also have previously the social climate for LGBTIQ people was not that favorable, and that's why the studies were different. There were stigmas against non-heterosexuals, and it was very deeply rooted. Today the situation is a bit different. Another one: how can we explain increased suicidality among non-heterosexual people? Why these people have these suicidal thoughts much more frequently? This study involves Lithuania as well, which demonstrates the experience of suicidal ideation among LGBTIQ, and the average is approximately 57%, which means that during the recent years, approximately almost 60% of LGBTIQ people were thinking about suicide. This only demonstrates that this problem is very relevant for Lithuania as well. One of the theories that we refer to in our thesis is the minority stress model, which is the widest one when we speak about the various experienced by non-heterosexuals, and this model explains various psychological problems that non-heterosexual people encounter. At the moment, we also have other theories created, but I would like to say that all other theories are only the elaboration on this minority stress model. The non-heterosexual individuals experience additional stress, which is called the minority stress, and this leads to psychological problems. This is additional stress, which is typical only to non-heterosexuals and only because they are non-heterosexuals. And this emphasizes that this is chronic and long-term stress. The study itself shows that the minority stress is related to suicidal ideation. That's why we selected this minority stress model for this study. However, it has certain ideations. If we take it from the suicidality perspective, we would like to say that this does not explain the increased suicidality. It focuses on the various psychological problems, but it is not very specific about various suicidality mechanisms. That's why it was decided to include another model additionally, that is the suicidal behavior model. This is an integrated motivational volitional model, and I will be calling it IMV. This is one of the most popular, widely applied suicidal behavior model. It is actually a specific motivational phase which is based on entrapment concepts, and it is related directly to suicidal ideation. Also, in this topic, motivational moderators, in this study, motivational moderators were involved. These are the factors that change the entrapment feeling, the effect of the entrapment feeling on suicidal ideation, and we selected interpersonal needs and social support. That shows that those motivational moderators can affect suicidal ideation, but IMV model may also be criticized because it doesn't take account of specific minority stressors. It was created for the overall population, and it's not clear whether we can apply this model when we speak about the suicidality of non-heterosexuals, or whether we have to dismiss it when we are trying to understand suicidal ideation among non-heterosexuals. So we can make a conclusion that none of those discussed models, neither the minority stress or IMV model, is enough to reveal the complexity of suicidal ideation and the actions related to that. Therefore, our study suggests the idea to integrate the constructs of both models, and this integration idea is based on the psychological mediation model, which states that psychological processes mediate in the relationship of minority stress with psychopathology. And in this diagram, you can see that minority stress may be specific social factors which affect suicidal ideation through mediation factors. The objective of the studies was to evaluate the relationship of sexual orientation with the frequency of suicidal ideation and to detect the suicidal ideation during the last month related to non-heterosexuals in Lithuania who are studying in Lithuania, and mainly speaking about adults, non-heterosexuals, taking into account the constructs of minority stress and IMV models. And here I mean people who work with LGBT people, and I studied those who work with them. And the main focus is how people should behave in the psychologist room. Is it enough to apply a simple suicide prevention method? We have been hearing about that for 10 years. Or are there any specific methods we should focus on, specific measures on working with non-heterosexuals? To put it simple, this thesis is trying to reply to the question how we should be working with non-heterosexuals who might be having suicidal ideation. For that purpose, for answering this question, we planned a survey. I will introduce to you the methodology. The final sample was composed of 18 to 20-year-olds who were studying at the moment of the study at a higher education authority and living in Lithuania, and they replied to the question to sexual orientation and at least once had suicidal ideation. So the survey was filled out by 2,864 respondents, and the final sample comprised over 2,000 people. It was a large scope. The questionnaire consisted of socio-demographic questions and study instruments, and only non-heterosexuals were replying to the questions related to minority stress. You see that what were the socio-demographic questions asked, and then how we evaluated sexual orientation. It may be evaluated in various ways, but here we actually referred to sexual identity. For instance, does the person think that they are bisexual or homosexual, and so on? What measures were applicable? To evaluate the construct of minority stress model, we used a few scales. We used discrimination on the basis of sexual orientation and also positive and negative aspects of sexual orientation. And there were negative aspects related to sexual orientation as well as positive aspects included in the study. Regarding the constructs of the suicidal model, we evaluated entrapment, then interpersonal relationships, or burdensomeness, or thought dependence. Feeling, and also social support at 3 levels: family, friends, and a significant loved one. And we also took different 3 time scales: the last month, the last year, and lifetime. And the respondents were asked one question, and they were divided into separate groups. And then we evaluated the depression and anxiety. We applied the quality cross-check data collection strategy, cross-cut data collection strategy, and probability selection, probability-based selection. And that was an anonymous survey. distributed through email in higher in education establishments in Lithuania, 17 of them. And there was informed consent also that was taken. What were the results? There were many. I have chosen the most important ones, especially the ones emphasizing various directions of prevention and intervention. One of the questions, if you remember, was what is the frequency of suicidal ideation during the last month? That is whether the problem that we are now analyzing in this research is relevant. In this slide, you can see the frequency of suicidal ideation during month, during the year, and over the lifetime. We can see that almost half of the respondents indicated that they had suicidal ideation during the last month, 60% during the last year, and almost 70% in their lifetime. What was important was that those results demonstrate the frequency of suicidal ideation in various sexual orientation groups. We had three groups. The first one, heterosexuals, the second one, homosexuals, and the third one, the joint group consisting of bisexual and other non-heterosexual respondents of the study. What we can see is that during the various evaluated periods, heterosexual students had the least number of suicidal ideation, from 40 to a little bit over 60. Then homosexual students from 54 up to almost 80, and the highest frequency of suicidal ideation was among the bisexual and other non-heterosexual students, from almost 60% to almost 90% in their lifetime. What does this study show? First of all, it only demonstrates that non-heterosexual students have much more frequent suicidal ideation, and this question is very relevant, and it's a huge problem. Another thing, as I have said, non-heterosexual people are not a uniform group. We see that various groups experience bigger, higher or lower risk. And we also have bisexual students group. Bisexuals experience the highest risk of suicidal ideation, which also coincides with other studies conducted, which is very important to be taken into account when also working in the clinical context. Another part of the results is the response to the second question: how can we explain why non-heterosexual people have much more frequent suicidal ideation? As I have said, we are trying to combine two theories. One is the minority stress theory, which emphasizes specific actions typical of sexual minorities, and secondly, the suicidal theory, that is the IVM model. Here, I will present to you only the network analysis results. I will not go into greater detail as a statistics method, and my colleague Jurgita has also mentioned some of those methods, but network analysis method is very useful to analyze suicidal behavior, which is a very complicated phenomenon encompassing many different actions, and they are intertwined between each other, and they affect each other. So this network method is very useful. Here we see the visualized network, which involves various actions included in the network. Secondly, why network analysis is very important in this case. This is a very good method when we are trying to create a uniform model which encompasses a few integrated access points. And secondly, this is very useful when we want to explain this to the practitioners, because the network analysis tries to outline which of those variables are the most important ones. Now, when we move on to the results, you see the visualized network with the variables and the bubbles. They are called the nodes, and in the legend you see which color demonstrates which variable. And briefly, yellow is the constructs of minority stress model. To put it simple, these are various mechanisms. They are very much interrelated. We may say that this yellow color and the grouped actions reflect the minority stress procedure, which are affected by various mechanisms which make them weaker or stronger. Blue designates the IMV model constructs. They are also interrelated, and we may say that this is a different process. We are analyzing two separate processes, that is the minority stress process and the suicidal process, and we try to identify their interrelationship. What we have noticed is that two processes are directly related to suicidal ideation, two processes out of the IMV model, the entrapment feeling and the burdensomeness feeling. These people feel that they are entrapped, maybe due to internal problems or external circumstances. These are people who feel a burden to others and tend to think about suicide, that these feelings, that is entrapment or burdensomeness, lead to suicidal ideation, and this indicates that we should start thinking about intervention, help, support. Another thing is that the minority stress is not directly related to suicidal ideation. It's in direct relationship, but rather via the suicidal theory constructs. To translate it into the simpler language, human language, what does it mean? That is, we may have an assumption that minority stress is a context where suicidal ideation is formed. Minority stress increases the vulnerability of non-heterosexual individuals. As a result of minority stress, non-heterosexual people are more sensitive and vulnerable to various suicidological actions. That is, the minority stresses are the context for the development of suicidal ideation. That increases vulnerability, and that's why people move to suicidal ideation easier. Then we evaluated the centricity of probable effect, and it evaluated how strongly each node affects the remaining network, and where we have to concentrate on when we speak about non-heterosexual young people and their experience. Two nodes became very noticeable. They are very important, and this probable centricity, the centricity of probable effect, shows that when working with those processes and internal psychological procedures, we can rearrange the whole network and we can prevent suicidal ideation. One of those actions was concern about being accepted. One of the actors of minority stress, one of the factors of minority stress is this one, and they cover emotional and behavioral and other elements. That is, people are always anxious whether they will not be rejected, whether they will not be discriminated or stigmatized on the basis of their sexual orientation, which is non-heterosexual. Our study shows that working on this anxiety and ideation and the avoidance of various social situations stemming out of that, and the avoidance to participate in life, that is working on this anxiety of being accepted is one of the crucial points when working with non-heterosexuals. Another important variable, family support. If you remember, we evaluated 3 different support levels, and it turned out that non-heterosexual young people were in greatest need of family support. And that was the most important factor. And the scientific research shows that non-heterosexual people who have their family support have less frequent thoughts about suicidal ideation. And on the other hand, if there's no support or the support level is low, this gives ground for the development of suicidal ideation. And these are 2 important factors when working with non-heterosexual people, that is the fear of being rejected, acceptance, and family support.
One more factor in the centricity of a possible effect, we see what knots are the main connecting knots among these 2 models. Which factors are the factors that connect these 2 models? What have we seen? I have highlighted these factors. This is the support from the family and the perceived burdensomeness. In simple language, these are the factors that are like doors. If these factors or these psychological mechanisms are functioning, if a person has high support from the family, it will be like a closed door which does not allow the minority stress to enter into this space. But if the non-heterosexual person does not have family support, the door opens and the burdensomeness enters the space, and the suicidal ideation starts to form. Burdensomeness is the second door when a person feels like a burden for his family or other important persons. You can see that this has to do with the fear for acceptance. It is very important to work with these 2 factors, because the people who are worried about being discriminated upon or not accepted, they are prone to feel like a burden to others. On the other hand, if a person does not feel to be a burden for themselves, it's like a closed door, and the minority stress does not enter into this suicidal process. And now to sum up, what does this study show? The first question was, what is the frequency of suicidal ideation among young and non-heterosexual people in Lithuania? The answers were the following: that suicidal ideation among young non-heterosexual people is much more frequent. In Lithuania, this frequency is higher than in other countries. Here, the cultural and socio-cultural factors are very important. Lithuanian socio-cultural factors and the stigmas that have to do with the heterosexual people. which is so widely widely spread in Lithuania. The fact that we have such a high number of non-heterosexual young people who think about suicide is a very important factor. It is also important that the suicidal ideation in the last month is the lowest one, and the suicidal ideation during the whole life is the highest rate. People who are now thinking about suicide have been thinking about suicide in the last month or even longer ago, which means that the process is a continuous process. And the last answer is that the highest frequency of suicidal ideation is among the bisexual community. It can be related to the minority stressors that are important for bisexual people. This group has a higher risk, most probably because they have stresses, minority stresses that are typical for their orientation. Bisexuality in our society is almost non-represented. It's something in between, which makes the experience of bisexual people even more difficult. The second question was, how could we explain the higher numbers of suicidal ideation among non-heterosexual people? Or how should we work as therapists with non-heterosexual people who think about suicide? According to our study, in order to understand the suicidal ideation and its causes in this community, it is important to understand how minority stress functions and how the integrated motivational evolutional model functions, or the general suicidology theory. According to my study, we see that the minority stress is non-directly related with the suicidal ideation. We could say that the minority stress increases the vulnerability and enters the suicidal processes and encourages the creation of suicidal ideation. This has to do with the directions of suicide prevention when we speak about non-heterosexual people. If we speak about the intervention that focuses on suicidal ideation, we should work with burdensomeness and entrapment. In simple language, if we have a patient who thinks about suicide and is a non-heterosexual person, we can use all our knowledge. We do not need to know anything new about the sexual orientation. We can use all the intervention methods that we already used. But if we speak about prevention, in the case of suicidality in non-heterosexual people, here we need to understand the minority stressors in different levels, from the lowest to the highest. The fear for acceptance, the fear for discrimination, the support of the family, the work with the family to increase the support from the family. And in the broadest sense, how could we encourage an inclusive environment for non-heterosexual people? How could we lower the discrimination levels? What could be the political steps? Here we could speak a lot. We have limited time today, but here I would like to share some links. Please keep into account that we have translated the guidelines of the US American Psychologists Association, how to work with non-heterosexual people. Here in Lithuanian, you can find answers how you could work with the minority stressors, what strategies could be applied. Our participants of the study were students from Lithuania, so we have also our guide, and we have guidelines for doctors about non-heterosexual people, but these guidelines are also useful for everybody who meets or who works with non-heterosexual people. And to sum up, why is my presentation called Silent Shadows? It is very important to understand that the suicidality of non-heterosexual people does not appear in some vacuum, in an empty space. It is formed in our culture, in the heterosexual culture, where only the heterosexual orientation is normal among a man and a woman, and all other orientation or relationship is not normal. And this space and this background is where the minority stressors emerge and lead to other processes leading to suicidal ideation. And we have to understand that this background affects non-heterosexual people all the time during all their life. I don't speak about one event of bullying or one event of discrimination. No, this background affects non-heterosexual people always, and it is some kind of cultural trauma. Repeating itself continuously, day by day, and they leave silent shadows. The silent shadows of people who feel themselves as a burden for others, they feel entrapped. So the conclusion is
kaip dirbti prevenciškai, kaip dirbti intervenciškai, bet mes turime suprasti, kad reikia keisti kultūrinę aplinką.
Working with a concrete person, it is important to change the cultural environment, and that's on us, how we can change this perspective from working to one person, trying to work in a broader sense. And here we see that in Lithuania, the stigma against heterosexual people is very deeply rooted. This stigma creates the minority stressors that increase the vulnerability of non-heterosexual people, and this leads to different suicidal different triggers and suicidal ideation. Thank you for your attention. I hope that my presentation was useful and you have found interesting insights.
Ačiū Jokūbai labai už pranešimą. Iš tiesų, iš klausimų skaičius, tai tikrai atrodo pranešimas be galo.
Thank you, Jokūbas, for a very relevant presentation. One of the questions that mostly came up with people was that these are very disturbing students' results. I had seen similar figures in Lithuania, but what has happened to students? Well, this is a very wide question. We are trying to determine why is it related, to what is it related, maybe methodological aspects. When maybe suicidal people were participating, students, for instance. On the other hand, this is our reality. On the other hand, people think about suicide, and including young people. And to compare to other studies carried out in Lithuania, these results are not very surprising. I shouldn't be able to reply what has happened, but one of the ideas may be that some sociocultural actions which increase those figures.
Dėkui. Kitas klausimas kyla vis, ar tyrinėtas ryšys tarp biseksualios.
Then we have another question whether the link between the bisexual orientation or borderline disorders are these is sexual orientation related to borderline disorders? Well, actually, no, we did not investigate any other personality issues, and maybe there were other things that I did not present due to the lack of time, but we didn't go into specific things, and I see that some studies are being made, and in the future we will consider that as well. Another question is related to the sample itself. Can it be that those who are not studying at university, who have dropped out of the system, even at a higher sample? Well, I wouldn't like to make this to make people even more anxious. People may have dropped out from the educational system, or they did not participate at all in the educational system. But yes, there may as well be that suicidality is higher, or suicidal ideation is higher among them, but we do not have the specific data, because at the moment we have only a few studies about LGBTIQ people, psychological and mental health. And one more question, because there's no time. In the sample of non-heterosexuals, the protective variables in the studied sample, is it different? Is it different from the sample of other people? Well, people do feel sometimes that they are burdensome, that they are a burden to others, but I have not opened more detailed results here. There are other protective actions. For instance, when you are proud of your sexual orientation, how a person accepts that, and whether the person may enjoy it. This is a very important factor when speaking about the suicide ideation. But there are certain protective actions that are specific to non-heterosexual orientations. There are general actions, but there are also specific ones. Thank you, Jokūbas, for this presentation. Now, we will make a 2-minute technical break to take care of all the technical aspects.